Maddie, now I'm going to do your anterior chest. Patient has no lesions and skin is symmetrical. Now I'm going to palpate the CVA and let me know if you have any tenderness, okay? Anything? No? Okay. Now I'm going to take breath sounds in each location. Take a deep breath when I say. Patient's breath sounds are normal and symmetric, and there's no tenderness. Okay, Maddie, now I'm going to do your neck vessels. I'm going to inspect for jugular venous distension in your neck. Can you turn that way for me? Okay, now the other side. Okay, patient has no jugular venous distension. Now I'm going to palpate your carotid pulse in separate times. Patient's carotid pulse is a grade 2. Okay, Maddie, now we're going to inspect your pericardium. Can you lay down for me? Okay, can you take a deep breath for me? Okay, and now I'm going to listen to our heart sounds and see if I can hear S1 and S2. Okay, S1 and S2 are heard. Now I'm going to auscultate the heart at the aortic area, pulmonary area, Erb's point, tricuspid, and mitral areas, and listen to the heart in the mitral area for 1 minute. Okay, patient's pulse is heard in all areas. Patient's rhythm is normal, and I can hear S1 and S2 sounds equally with no murmurs or extra heart sounds. Okay, now I'm going to listen to your heart sounds with the bell of my stethoscope in the same 4 areas. Patient's heart sounds are still heard in all 4 spots. The rhythm is normal, and I can hear the S1 and S2 sounds equally with no murmurs or extra heart sounds. Now we're going to inspect your abdomen. Let's check out your skin. Okay, skin is free of lesions, lumps, or scars. Now I'm going to shine a pen light, and I'm going to need you to take a deep breath for me. Okay, rib cage is symmetric during the breath. Patient's abdomen is symmetric and flat with no bulges or lumps. And now I'm going to listen for bowel sounds in each right, left, and upper lower quadrant. Bowel sounds are present in each quadrant. Now I'm going to oscillate the quadrants again for the vesicular sounds. Specifically, I will do between the xiphoid process and the umbilicus. There are no vesicular sounds present. And now I will percuss the abdomen in each quadrant. Let me know if you feel any tenderness. Okay. Patient has tympany and no dullness in each quadrant. Now I'm going to palpate lightly and then more deeply to inspect the organs. Let me know if you feel any tenderness. Any tenderness or pain? Okay. Now I'm going to palpate the femoral pulse in each leg. Okay, patient's femoral pulse is graded 2+. Okay, Maddie, now we're going to move on to your lower extremities. I'm going to inspect each leg and check for edema and make sure the muscle bulk and hair distribution is equal. Okay, Muscle bulk is symmetric, and so is hair distribution on the legs. Now I'm going to inspect in between your toes. Okay. In between the toes is free of verrucosities, and the spaces in between are dry, pink, warm, and non-tender. Now I'm going to check the pulse on your posterior tibial and dorsal pedis. Okay. Patient's pulse is graded 2. Now I'm going to palpate again for temperature to make sure they're equal and any tenderness. Patient has no sign of edema and both lower extremities are. Okay, now we're going to do the range of motion of your legs. We're going to extend the leg for me out. Now bend for flexion and up to your chest. Now this one for extend, flex, and up to your chest. And I will take each leg and do abduction and adduction, abduction, adduction. Okay. Patient has 130 for flexion and extension, 90 for hip flexion, 45 degrees for hip adduction, and 30 degrees for hip adduction. Okay, Maddie, now we're going to do your upper extremities. I'm going to inspect each for muscle bulk. Okay, patient's muscle bulk is symmetrical and they're free of lesions on the skin. Palpate your radial pulse. Both hands here. Okay, patient's pulse is graded 2. Now we're going to do the range of motion in your upper extremities. Can you make a fist for me? Okay, and flex. Okay, palmar flexion is 90 degrees. Now raise arms in front of you for shoulder flexion. Raise arms above your head for shoulder abduction. Okay, and now we'll pretend you're combing the back of your head for external rotation of the elbow. Okay, shoulder abduction is 180 degrees, external rotation is 90 degrees, and shoulder flexion is 90 degrees. Okay, now I'm just going to test your arm strength. Can you go against my resistance towards yourself? Okay, and this one. Okay, patient's strength is adequate in both arms. Okay, Maddie, now we're going to move on and do the neurological part of your exam. I'm going to take this alcohol swab and wipe on both of your arms and on your face. You let me know if you feel any pain. Nope. Mm-mm. Nope. Nope. Okay, patient has no pain in these areas. So now I'm going to do the vibration test and do it on your big toe and your wrist, and you let me know if you feel the vibration, okay?
Okay.
Can you feel that?
Yep.
Feel that?
Mm-hmm.
Okay. Wrist?
Yep.
Mm-hmm. Okay. Patient can feel vibrations in all now areas. I'm going to do your deep tendon reflexes. I'm going to start with your bicep. Good. Good. I'm going to do your triceps. Good. Good. Okay, and now we're going to do the patellar and quadriceps. Good. Good. Okay, and now we are going to move on to the Achilles reflex. Okay, patient responded well to all of these. Now we're going to do the Babinski test. I'm going to slide this on the bottom of your foot. Okay. Okay, patient has no signs of Babinski. Now we're going to do the motor skills. Can you stand up for me?
Yep.
Okay, can you walk in a straight line heel to toe for me? Okay, can you walk on your heels? And now walk on your toes. Okay, patient can walk in a straight line and balance as well. Now we're going to do the Romberg test. Can you stand there with your hands at your side and feet together? Now close your eyes, and I'm going to watch this patient for 20 seconds. Okay, patient's balance. Okay, Manny, now we're just going to do the range of motion of your spine. Can you do sideways for me? And now the other side. Can you turn at the waist to both sides? Okay, now bend forward for me. Okay. Flexion is C-shaped curve for this patient. The lateral bend is 35 degrees and rotation is 30 degrees. And that completes my head to toe assessment.